Hello, everyone. Welcome to the Global Virus Network's Forefront of Virology webinar series. I'm Dr. Maggie Bartlett, the Program Director for the GVN and your moderator today. We're so pleased to have Dr. Nadia Sam-Agudu with us to present on Viruses Without Borders, Global Health Research in Pandemic Responses. Dr. Sam-Agudu is a distinguished physician, researcher, and a leading voice in global pediatrics, infectious diseases, and implementation science. She's a professor of pediatrics at the University of Minnesota Medical School and a senior technical advisor for pediatric and adolescent HIV at the Institute of Human Virology in Nigeria. Her career is focused on improving health in these vulnerable populations and has contributed truly groundbreaking research on HIV prevention and treatment in children and adolescents, with critical studies emerging on viral threats like mpox and SARS-CoV-2, particularly in Africa settings. Dr. Sam-Agudu is renowned for translating her scientific evidence into practical solutions that impact patient care and public health policy, making her an exceptionally insightful and relevant speaker for our webinar today on navigating viruses without borders. Without further ado, Dr. Sam-Agudu, please take it away.
Good morning, good afternoon, good evening, everybody, and thank you for making it today. And thank you so much for your lovely introduction. I hope you can all hear me well. I'm going to share my slides now so that we can start off. Okay, so let's try this again. All right. So today, usually when I give these types of talks, I'm talking very infectious disease, very maybe virology type or parasitology or bacteriology. But I thought for this talk, we do a little bit of more soul searching kind of discussion here. So I'll just disclose a lot of my work centers around HIV research and then also more recently mpox research. And these are my sources of funding that I have currently. What I will not be talking about, and largely because it's been discussed extensively on large platforms, and I may not even be the best person to discuss them especially in this forum, is the global level topics of public health preparedness and response to pandemics, global health solidarity that we've been talking about even more intensely since the COVID pandemic came around, pandemic treaties, large research infrastructure for pandemic response. That's not what I will be talking about. But what I will be talking about is really for us individually and as teams in both high income and low and middle income countries from a more soul searching approach to discuss global health research and pandemic response, our global local research at our individual and institutional level, our individual and institutional preparedness for country level and regional research, and then also as it would be if I'm speaking, to leveraging some implementation science methods and skills at the individual institutional level as we talk about global health research in pandemic response. And the focus here is more on preparedness than ongoing response, although there are many of us who are doing our research in response to ongoing pandemics, example, mpox. So while we have the global bodies like WHO and the big consortia and country level committees framing the big picture for us, we as individuals plus our teams should also be keying into that big picture and preparing ourselves at the individual team level and also our institutional level to be able to key into this picture and have a more coordinated preparation and response to pandemics. So I want to talk about individual preparedness for pandemic research response. And as I'm doing that, I want to iterate or reiterate pandemic research preparedness, which are proactive strategies and activities undertaken to understand, prevent, and mitigate the impact of future pandemics. That's preparedness. And then there's pandemic research response, which are scientific efforts and strategies employed to address an ongoing pandemic, including research into the disease, its transmission, and potential treatments and preventative measures. Now, in terms of preparedness, I want us to think that the global preparedness involves individual preparedness. And preparedness are more generally speaking, is a state of readiness, right? Especially for war. And in this case, we are preparing ourselves for war against pandemics and organisms that cause pandemics and decimate human populations, destabilize our economies, and really threaten our very existence as humans. So pandemic preparedness at global and regional levels should also be considered. But preparedness at individual, small group, or institutional level is more what I'd like to talk about. So for example, at the individual level, I might be looking at my research capacity building in general, or how I am doing research capacity building for others, emerging infectious diseases training, pandemic response. And typically we typically focus on epidemiology or lab or basic science. But we don't tend to look at pandemic preparedness for all research stakeholders. And research stakeholders also include non-researchers, because these are people as researchers that we also engage in the process of doing research in pandemics or in response to pandemics. So research stakeholders may not necessarily be researchers, but they are important for involvement and engagement in research. So I thought of the terms, viruses without borders, really, because while pandemics are not solely caused by viruses, viruses are the single biggest cause of pandemics. Just as these viruses have no borders, researchers should be prepared to approach their research or be prepared to do borderless research. Now think about pandemic research the way viruses select human hosts. Viruses go for the most vulnerable. They go for situations or populations or communities that are amenable to sustained active infection. They look for the biggest potential for widespread transmission, and they have no respect for borders. So I want you to think about that. We have to align our preparedness with readiness, and preparedness aligns with readiness, right? We defined earlier preparedness as a state of readiness. But readiness, as an implementation science term, is the extent to which an organization or individuals are willing and able to adopt and implement a new intervention or change. So readiness is a key marker for successful implementation and sustainment of an intervention or an activity, but it's not binary or static. It's a process and can change over time. So now extrapolating this to readiness, So extrapolating this to readiness for pandemic research response, we can define it as the extent to which an organization or individuals are willing and able to plan, to conduct, to report, and apply research in response to an impending or ongoing pandemic. And readiness is crucial because it significantly influences the likelihood of success in implementation, success in action, and success in positive outcomes. So some questions that you need to start asking yourself and your team or institution. Remember, I said we are not doing the picture that is too big here. We are going small, individual and team, and maybe institution. Am I willing to do pandemic research? Or did I kind of get trapped or trap myself in it? I really don't want to do it, but I'm just here. Am I able to do pandemic research? And am I willing, if I'm willing to do pandemic research, to do it with a global health approach? What do I do to prepare myself or to better prepare myself if I actually have some will to do this? And note that will and skill can change. And I want to put a positive spin here in that it can change for the better. It can change for the worse too. But think about it, because especially for some folks, including myself, who feel very committed to doing pandemic research, we train for it. And not everything that you train for is something you actually wanted to do. You find that as you go along, as you mentor people. And that's part of the job of a mentor, helping someone to find the best of what they want to do and do the best at it. And so sometimes we have to take stock and say, am I willing to do pandemic research? Am I able? But at the same time, as you work with people, you have to ask, especially if you are their supervisor or you're supposed to be the leader to run this team, is this person or are these folks willing to do pandemic research? Are they able to do it? And are they willing or able to do it with a global health approach? And I want us to take stock of this. And so there's a will and skill matrix, right? You can have people in different quadrants of this schematic. Some are able but are unwilling. Some are able and willing, which is where you want most, if not everyone, to be. Some are unable and unwilling, and some might be unable, but they are willing. And so people are in these different boxes, and note they can move into these boxes at different times. But I would say that generally there's one box that you find yourself in most of the time. But there are people who have been moving through these boxes throughout their careers, or even a short period of time might be moving through these boxes. And I want to say in the current situation where we have significant decreases in funding at the global level, but also from the US government, people's motivation have been significantly affected, and people have to make real life decisions about continuing to do pandemic research or not. And some of that is simply because they just can't have appropriate remuneration for their work. They can't even find a job, or the jobs that they had are now really highly insecure. And people like security in life, particularly in their jobs. So critical questions to ask beyond the questions I've asked, especially when you're looking at high income versus middle versus low income countries, given the resources you may or may not have access to. Am I, as an individual, pandemic research ready? If I'm not already leading, do I have the skills to lead a team? Not everyone who's put in the charge of a team actually has the skills. So if you're there, do you have the skills? Are you willing to upskill? If you prefer not to lead, do you have the skills to still significantly contribute as an individual? Not everyone leads or leads every team at every time. But if you're part of the team, you got to be making significant contributions to get that agenda moving. And are we as a research team or a center or institution pandemic research ready? For instance, will the absence of one or a few individuals undo our readiness and dismantle our infrastructure? And is our infrastructure in general pandemic research ready? So how do we assess readiness to go to war on viruses without borders? And in true implementation science fashion, there is a framework for thinking about that. And Scasia et al. Propose a means of assessing readiness and its influencing factors as this equation of R equals MC squared, where R is readiness, M is motivation, the first C is general capacity, and the second C is innovation-specific capacity, which I will also call, for the purpose of our talk here, field-specific technical capacity. Now, how do we then take stock of our individual and our team's readiness? So when you look at R equals MC squared, you can, and I sometimes do this with myself, but I think I also need to be better at doing it with teams. You might feel individually you are quite, well situated, you know what you want to do, you are motivated, you have the capacity, but you have to ask yourself, for your team and for your institution, if not just yourself, is my team ready? Because it's very hard to do any of this work as an individual. You are working with teams, whether at one institution or multiple institutions. You have to do regular honest self-assessments and team review to evaluate progress, identify areas for improvement, align with goals. And we do this, but have we done this with respect to our readiness and the components of readiness according to this R equals MC squared equation? For yourself, you might reflect on your career skills and achievements, but for your team, you're assessing goals, the structure, and addressing the question of, do you have the people, but not only the people, but the culture to foster improvement, communication, and productivity with respect to pandemic research preparedness? And note that while the authors didn't talk extensively about it, this equation, while great, assumes that you're going to be retaining key staff and assumes that you will have steady influx of new staff. And note that, there are many places where there's a high turnover of people, and trying to build readiness in a team whose composition is changing very fast is a really tough job to do. And so those are issues too. So when I think about readiness and long-term readiness, I have to also think about retention, and I have to also put in measures to keep the staff that I have, especially the ones that are both willing and able. And that's something we have to plan and think about in the way we hire people, the way we treat people, and the way we provide people support, not only salary, in their jobs to stay with the teams, be motivated, and feel appropriately supported. So breaking down readiness, we start with the M in motivation, which is organizational members' shared resolve and commitment to adopt or implement the change, or in this case, to conduct pandemic research. This includes beliefs about the intervention or the field, its perceived benefits, and a collective desire to make things happen. So if you're applying this to your pandemic research preparedness, again, do I want to do this work? Do I find it useful? Or if I found it useful before, do I still find it useful today? Look at the current climate of global health, infectious diseases, and vaccine research funding. And that's an extra cause for poor motivation. Consider your team, institution, or center. Do we or do they actually want to do this work? Do they find it useful? Is our leadership or our procedures positively or negatively affecting motivation? Extremely important questions to ask. Then we go to general capacity, which is the overall ability of an organization or individual to function successfully on a day-to-day basis and to implement any intervention or to support pandemic research. And these things include factors like leadership, what is the organizational culture and climate, staff capacity, available resources, and processes. These are things that might not seem tangible processes, but they affect the way we do work. They also affect our motivation and affect our efficiency. So applying to pandemic research preparedness, starting with yourself, do I have the general capacity? Or do I have the capacity to do the work at the level I expect or that I'm expected to? Do I have capacity to lead others? Have I established the right organizational culture and climate? Now, organizational culture and climate don't just come from, the CEO of the organization or the president of the university or the head of your department. If you are working within a team, whether you're a member of a team or leader and member, I think of it as everyone has their little halo of or mini system in which they help to establish a certain culture and climate. And those units then build to contribute to the overall culture and climate that the CEO, the president of the university or the head of the department moves forward. Of course, those leaders have more influence on the overall culture, but we individually also contribute to the overall culture. And then consider your team, institution, or center. Do my staff have the capacity? Is their capacity at sufficient levels? And does my institution have available resources and existing processes? Then there's your innovation-specific, or would I say field-specific capacity. That refers to specific knowledge, skills, and conditions needed to implement a particular innovation or pandemic research or preparedness or readiness for pandemic research. Now, this is specifically specialized training, resources, processes, and a supportive climate tailored to that particular intervention or that particular field. So starting with yourself again, same questions. Do I have specific capacity? Do I have specific capacity to lead? Have I established specific culture and climate? And then same thing for your team, your institutional center. Now, we've talked about these different things, components of R equals MC squared, but this is also a discussion we are having in the context of global health approaches to pandemic research and preparedness. I cannot say this enough. Global health is centered on equity. Global health cannot be defined or practiced without the term equity or without the practice of equity. And especially in this climate right now, especially in the US, there are many instances where I'm finding myself maybe leading a global health session or part of a global health activity, and we are trying to find ways to talk about global health without using the word equity. It just doesn't make sense. So just as viruses without borders target people and geographic locations without limitations of borders, we should be prepared to do so as well. And yet, yes, there are practical or very real life things of laws and policies and procedures that change once those, albeit imaginary geographic lines are crossed. Yes, those are there. But as researchers that are looking at doing pandemic research or doing research in response to ongoing or future pandemics, let's look at the individual institutions and have our mindset focused on doing work with an approach that is not limited by borders. We are looking at individuals and institutions doing pandemic research who should by definition be cross-border or border neutral in the way that we work and the way that we interact with entities across the borders that we are trying to work against or in spite of, let me just put it that way. So where is your equity centeredness in pandemic research preparedness? At your individual level, at your institution level, as you discuss project after project after project, where is your equity centeredness? Do you talk about equity at all? Teams and geographical scope of collaborations. Those are places, even your team composition, but then your geographical scope of your collaborations, both local and international. Your processes, where's the equity centeredness there? Your physical space, your communications, your leaders and leadership all the way to the top. Where's your equity centeredness? My individual lessons that I've learned in pandemic research preparedness, cover a few pandemics, and I was thinking about this the other day. I actually looked at the timeline of when I finished my infectious disease training. It was 2008 when I finished my subspecialty training in pediatric infectious diseases. Not even 6 months after that, the H1N1 swine flu hit, and I was in the US at that time. So I immediately found myself thrust into sort of doing pandemic preparedness and response. I'm largely clinical work at that time and public health, some public health work. And then, of course, in between Ebola and other outbreaks came in. By that time, I was in Nigeria. And then, but majorly so, COVID-19 with my colleagues at AfriHealth, we conducted research in several African countries. And then now we have our mpox Research Consortium, and that's doing mpox research in endemic African countries. And then I'm part of large consortia doing both mpox and COVID-19 research, such as Verdi. And I'm asking myself, what's the next pandemic? But I'm preparing myself for that as well, because I want to stay in this field, but I want to be maximally useful to this field, as well as the people who work with me in the different teams. So I have a couple of institutional examples. There are many examples that you all can also give. You are working in institutions that have been established specifically for the fact. I'm just giving a couple of examples that I am connected with. So I'm at the University of Minnesota, and we just earlier this month established the University of Minnesota Institute on Infectious Diseases. There's our website, and really our mission is to identify and respond to emerging and contemporary infectious diseases for outbreak and disease mitigation and control, and to train the next generation of pandemic and epidemic response experts. Now, we all have our different divisions in different aspects of the university, and this is not limited to the medical school, by the way. It's multiple schools across the university. But we realized it was important to actually consolidate those efforts under one entity, while still working, in our different capacities and entities, but making sure that we have a ready group of people whose training, talent, human resources can be channeled into preparing and responding to pandemics. And part of what I really like about this institute is that they also have consolidated support for writing grants and for administering the work and getting that well coordinated. So it's not only scientists, but administrative leadership as well. So that I find that very helpful. And then I'll cross to the other side of the Atlantic, where I'll briefly mention the International Research Center of Excellence at the the Institute of Human Virology, Nigeria, with whom I've been affiliated since 2010. We have a cognate relationship with the Institute of Human Virology in Maryland, where I was previously. And our focus is broader than emerging infectious diseases and pandemics. However, we do have a portfolio on pandemic research in Nigeria and across Africa. And this is just mentioning a few of what is going on right now, I think. But we have also established, particularly for mpox, since it's been a persistent problem and still occurring in Nigeria, DRC, other West and Central African, and even East African countries, that we have a unit where we have teams that are doing mpox research, and we give ourselves updates on what we are doing, needs, things that we need, and what are our capacities with respect to doing different types of mpox studies, quantitative, qualitative, mixed methods, basic science, implementation science, all of them. So I just have a few take-home points here, and I'm sort of putting a little bit of the implementation science back in the discussion. Readiness is crucial for the success of doing. Doesn't matter what you're doing. Readiness is crucial for doing and for the success of it. When readiness is high, individuals are more likely to engage in the doing. They are more likely to put forth greater effort and persevere through challenges. Conversely, low readiness can lead to resistance, avoidance, and ultimately failed efforts or action. And there's ample evidence to show that a large proportion of organizational level efforts and projects fail due to a lack of readiness. And the success of pandemic research responses partly lie in how ready individuals and institutions are to respond. And those build up into the global level readiness. It starts with individuals and institutions. And remember the R equals MC squared, where we are looking at readiness, but inputting high motivation, high general capacity, and high innovation specific capacity or field specific technical capacity. These are a couple of references that I use and acknowledgements for a few of the consortia I work with. I didn't list everybody here, but a few of the consortia I work with and the support I have for my research to date. Thank you very much.
Thank you so much, Nadia. That was a phenomenal overview. I want to invite people to put their questions in the Q&A box and I'll address them. I want to kick it off by asking you what we can do to help inspire the next generation to have that motivation, as well as obviously they're already passionate in this area, but there are a lot of things happening globally that are impacting definitely my trainees and I'm sure yours as well. So what can we do to help nurture that?
Yeah, and I will start from people who provide administrative support. I mean, I don't know if enough of us doing the scientific work reiterate or like give shout outs to admin people, but I want to say admin people are just so crucial and so important. There are times when I'll decide to write a grant or pursue a grant because I know the admin person, I know which admin person is going to support me. That can be a huge factor because I was like, okay, I have this person with me. He or she is going to help me. Okay, I'll do it. Because that admin person is so good, so motivated, and also really helps me to navigate the challenges. So I would say for a lot of my colleagues who do admin work, thank you. And please, you are a huge source of motivation to us. Like, if you don't know, I'm telling you today, huge source of motivation. And the way you work with us and give us support, and yes, all the reminders and giving us a hard time about deadlines, I appreciate that. And I really would say continue doing what you're doing because you're a huge source of that big M in the equation. So, and I'm also very committed to making sure that we have admin people who are very supportive, especially for researchers who are starting out in this field. It can be very rough dealing with all the admin staff. So that's one. The other thing we could do is that our leadership, whether it's even a leadership of a small team or a whole department or a whole institution, how you treat people and how you provide support, material or immaterial, is really something that trickles down or trickles across to people and gives them a sense of belonging in the institution at large. And that contributes or may limit retention. Retention is incredibly important. A lot of times we talk about patient retention in our HIV programs, malaria, TB, whatever. We need staff retention. We need staff retention. We need human resource retention in our pandemic preparedness and response teams. And that is highly contributed to by the organizational culture and climate, a lot of which is set or moved forward or limited by the leadership and how they behave and interact with people. The next two is fairness, equity in how we hire people and how we promote people. You can sit at an institution and see others being, well, a lot of time, I think most people, we tend to overestimate our, we all overestimate our skills. And I hope we do more overestimating than underestimating. But sometimes you see people being promoted or being paid more where it doesn't make sense to you. We need fairness in hiring and promoting, because that helps people to be inspired to stay and contribute. And we need fair remuneration and a transparency of how we do that. So I think those are, four big areas that I wanted to contribute to that, keeping people inspired.
No, I love that. I think those are all key areas. And on the retention point, I wonder if you might speak about the impacts um, in your research that current changes in funding have had. I know we've had changes to like the number of grad students we can have, and I think a lot about what does pandemic preparedness look like in 10 years if we can't take on as many grad students.
Yes.
So can you address that a little?
Yeah. And I think I don't think we can talk about retention by just, not that I'm saying you're doing that, but I don't think we can talk about retention by just looking at like research only, because especially for me, my work goes from research to clinical to public health, and it needs, and then to the general population or communities. So you need retention of people in all of those areas to get this to work, especially in implementation science or. And so we have lost staff in our public health programs. We have lost clinical staff, either brain drain or simply people who just weren't paid, and it became even worse with the new changes. And we have lost staff in research, in the research field. And already we are losing people who were going to join in this field. Like, it's the worst time for people graduating from research type fields or global health type fields. You're coming out with a PhD or a master's and you're like, what am I going to do? I've had so many people tell me that. Or, where am I going to get a postdoc? Postdocs, people have frozen postdoc programs. What do we do about that? One of the things is, first of all, I believe in paying people for their work.
Yes.
So you can't just keep saying, you volunteer or you intern. Even for interns, I believe in paying interns. Okay, unless they're from a wealthy family and don't really need that money, which is rare. So to look for other sources of funding, you see in some of my funding, I had NIH funding, but I've also had to look at non-NIH funding, go to look at European
Mm.
commission funding, look for foundation funding. And then something that I think I could do better at, and I'm terrible at doing fundraising, right? Asking
Mm.
people for money, but being better at doing that, because there are people who, if you connect them with the idea, things that you're trying to do, will donate some money to get people paid, get people supported, get people trained, and keep us on track with addressing pandemic. So you really have to go into different sort of creative ways to get people in. But one of the things that I also think is great is how I myself am responding to this and inspiring people to say, well, if Dr. Nadia is still staying, maybe I could stay too. Like, she's encouraging me, but she's not encouraging me out of a vacuum, saying, okay, I will try and find funding, I'll do XYZ, XYZ. So looking at different aspects, different opportunities, and talking to a lot of people about where to find the resources that are needed, because we cannot give up. Pandemics, viruses do not care about whether you have enough postdocs or staff. They will still come along. Yeah, thank you.
Well said. I love that sentiment. I'm going to address one of the questions in the Q&A. Thank you, Professor Sam-Agudu, for an insightful presentation. One core component of preparedness and readiness is the baseline level of knowledge and the ability to create new biomedical solutions, whether they're vaccines, therapeutics, diagnostics, for pathogens of pandemic potential, some of which may not be known, like what we call disease X. From that
Mm-hmm.
perspective, in African countries, what would you suggest as an approach towards this kind of preparedness and readiness?
Yes. So thank you for that. A lot of times we talk about in-service training, where people have already had their sort of baseline degrees of training and we are sort of training them as they are doing their profession. But I've also thought of stepping back and doing pre-service training. So pre-service training, say for a physician or a nurse, would be when you're doing your nursing school, nursing degree or your MD. What are we teaching people? There are people who are doing now their masters or their PhD versus a postdoc or postdoctoral training. How much of disease X information, pandemics, emerging infectious disease are we putting in there? And that becomes a very hard place to crack because a lot of what things people like myself do is basically in service or a training or where they've gotten the degree already, especially, for example, at the Institute of Human Virology in Nigeria or even IHV Maryland. We don't run, for the most part, the degree programs. We are running alongside the degree or after the degree, which is where we can add a lot of these things. But the baseline knowledge is important. And so part of where I'm trying to crack now is in medical schools and in within PhD programs, which we used to, we've had funding like from Fogarty to do that. Again, that has been reached, come down to now in the pre-service, bring in implementation science, emerging infectious diseases, the concept of disease X, because we have to update and upgrade our knowledge. When textbooks are great, but they're usually at least 5 to 7 years behind. It takes a long time to write a textbook. And so we have to do these sort of updated courses at the degree level and not after the fact, so that they are already exposed to these things and we can build on that after that. It's a lot of work, which is why I love working in consortia, because then you can consolidate power and make change. So thank you.
No, absolutely. That is a fantastic call to arms for how we can do better and train. Um, I think that's such a fascinating approach is how can we create new courses that are adaptive? I certainly didn't hear about or have a course specific on implementation science. I don't know about all programs, but I would imagine it's very specialized. So having that integrated.
And it's hard work. I do have a grant right now that's teaching HIV research and implementation science in Nigeria and formatted specifically for Nigeria or for the region. And I've had to work on the content from scratch. It's a lot of work.
So, in that
Yeah.
way, what are things that GVN could do to help empower these sorts of ideas that you have?
Yes, so first of all, working with a group of people who have, a collective mission is great. There's a certain protection, a sort of protection of the herd, right? I might be strong today, I might not be strong another day. There are some aspects in which I'm strong, aspects in which I'm not. What would be also great is that GVN help to foster the connections or to help us to make the connection. Some of us might not be the best at finding that other person in the GVN network, but if you, Maggie, emailed and say, "Hey, Nadia, I heard you wanted to do this. Well, there's this person." Like sometimes you gotta,
Yes,
put
yeah.
people together and say, "Hey," and then maybe we have, you know, a webinar or will support just a small meeting or something to just help that move. And then also giving, as I said, administrative support is very, very important. There are many times I have a long to-do list, but sometimes just needing someone to help me, to needle me, to support me to get it done. So sort of the network is there, but helping to create the relationships within the network and to find people who, while I might be able to support someone with something, that person might be able to support me with something that I don't have. And really, so helping that networking is great to have the network. I appreciate that we have small committees and interest groups within GVN. That's also extremely helpful. But to help keep that going and then provide just small, whether it's administrative or there's a little funding to do this. There's $500 to bring a young person to do this or whatever. Let's get that still going. I appreciate all of that, that help. And then helping to platform people of whether it's early, mid, or later career in different places. It's really great for GVN to help platform the work. Like for instance, this webinar. Yeah. Yeah.
Thank you. Those are all fantastic things, and I'll definitely follow up on them, Nadia. I have another question in the chat for you. Thank you for your kind presentation. Mine is the current issues of funding. A student like me who has interest in molecular virology in other courses, we find it difficult to get a supervisor, especially for masters. What is your advice for that student or others like them?
Yeah. So, and I'll tell you, I've certainly have had to myself turn down some requests for from masters, both masters and PhD, in a field like this where we're getting, the funding hit has been going on for a while. It's just been really bad in the past couple of years, and having sort of more or less the same critical mass of mentors and supervisors um, being committed. A lot of us are overcommitted. I'll be very, very honest with you. Overcommitted. You are on a project at 10% or 5%, 50%. You are working way
Yeah.
more than that. We are constantly working. And I want mentees and potential mentees to think about how much mentoring and how overstretched a lot of mentors are, especially if you're in a region, or country that doesn't have a lot of these folks. We are overstretched and we are expected to write more grants and keep going. And some people are just ending up in the hospital with just fatigue. So you are really, even before you start doing your mentor supervised or supervisor work, you are competing with other mentees for the mentors. So you have to now start to think differently in how am I going to present myself or my project, my capstone, whatever I want to do in a way that a mentor will say, okay, I want to sign on with this person. So you have to present yourself and prepare yourself against still preparedness to be the kind of mentee that someone will say, okay, this person is most likely to succeed if I take them on. And then always keep acknowledging, first of all, the time commitment that the mentor supervisor is going to put in. Because for most projects, the mentor supervisor is not paid. We don't get effort for the mentoring. So you start acknowledging from the get-go and then start doing this in a way and working with them or approaching them in a way that acknowledges how much investment they would make in you if they signed up with you, and then start finding ways to say, okay, I will do this, that, so that you can come in with this, that. Like, this is how much I will try and take away from your plate so that you can make space for me to mentor you. But honestly, sometimes I get requests that are very, I'd have to say, sort of entitled, like, I'm doing this and can you be my mentor? Well, what should make me want to pick you as a mentee? Right. So that's the question I would put to you. Yeah.
Thank you. I think that
Yeah.
advice is very helpful as someone who also has had to say no to a lot of candidates. All right, let's see. If there are no other questions in the Q&A, I want to thank Dr. Nadia Sam-Agudu for a phenomenal webinar at this Global Virus Network's Forefront of Virology series, and invite everyone to join us at our next one, which will be from Dr. Hongshu Song, Escape by Shifting, a Novel Mechanism of Immune Evasion. That'll be September 23rd at 1 p.m. Eastern Time. And just like this one, will be available for continuing medical education credits if that's of interest to you. Thank you again to our phenomenal speaker, to everyone who asked questions, and I hope to see you all next time.
Thank you, everybody.
Thanks, Nadia.